Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Hello and welcome to the 59th episode of the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. And today we're going to be talking about a super important topic of how to actually get this 24-hour urine test. I wanted to provide just a little bit of background about what this test is and why it's so important. I know I talk about this all the time, but it could not be more important. So always like to throw in that information whenever I can. So a 24-hour urine test is really going to tell us why you're forming kidney stones. This test is pretty easy to do. You do have to collect your urine for 24 hours, as the test implies, but it's pretty easy. Generally, this test is done through a company called Litholink. They do the vast majority of the 24-hour urine testing. This company was actually started by one of the nephrologists that I used to work with at the University of Chicago, Dr. Fred Coe, but it has since relatively recently been sold to LabCorp. So now it's all through this LabCorp system. But anyway, it's still Litholink/LabCorp. And the reason that, if possible, that you can get your 24-hour urine test done through Litholink is because if you get it done through Litholink, you know that we're going to be measuring all of the things that we really need to know to really understand what's going on with your test. A lot of times, if you get it done through like a hospital lab, they just won't measure all of the things because they maybe don't know to measure all of the things that a Litholink test will do, or they don't have the capability, because to measure some of these things, especially oxalate in your 24-hour urine test, you need to have special reagents, and like oxalate isn't super stable, and so they have all sorts of systems and protocols in place basically to make sure that you're getting everything that you need and that you're getting accurately, right? Which is important if we're going to be looking at this test to come up with a prevention plan for you. So anyway, all you do typically when you get this test done through Litholink, and honestly, even if you do this test through one of your local labs, the collection process is generally pretty similar. I know I've had patients and students who have done it through Mayo clinics, and they have a lab that is able to do all the things as well, but most hospitals don't. Anyway, so if you are going to do this test, typically your lab collection kit literally gets sent to your home. So you'll get a nice box in the mail, and it has a big jug where you're going to collect your urine, and you're going to get a hat if you're a woman, because it's really hard for women to pee into that big jug. And you're also going to get a tiny little tube of a preservative that you just need to put in that collection before you start collecting your urine, because that's going to help make sure that all of those things that we want to measure are stable and they get to the Litholink lab. So then there's beautiful instructions. There's nice pictures to make it nice and easy. You literally just collect your urine for a 24-hour time period. You shake up your urine, send it a little bit, pour a little sample into a tube that they provide you. You put it in a nice little box that they provide you, fill out a super easy form, and you put it in the mail and ship it out. You write down your total volume, and that is it. And so a lot of times, one of the reasons that doctors will not give patients or not recommend 24-hour urine tests, or their excuse for not getting 24-hour urine tests for patients is, oh, it's such a pain to do. Well, kind of like it's not fun necessarily to collect your urine for an entire day, right? A lot of times people do it when they're at home because it's obviously very hard to do at work and whatnot. But I would argue it's a whole heck of a lot easier than having another kidney stone. And certainly a lot easier, I would say, than even going into the doctor. And, I don't love needles. And so, I don't love going in and getting blood drawn. So it's really not that hard in the grand scheme of things. A side note on the blood draws, a lot of times a doctor will order a blood draw in to be done at the same time or right after you collect your urine. So sorry for my fellow people who don't love needles. Sometimes you do have to get just a really, really basic lab drawn, because if the doctor can look at your blood levels of things at the exact same time or pretty close to the exact same time that you collected your urine, you can get even more information from this test. So sometimes, not all the time, there is going to be a blood draw that's associated with the 24-hour urine test. So That's all you do. And in order to get this test ordered, literally your doctor just has to order it for you. This is something that your doctor should be ordering for you automatically. Typically, your urologist is going to be the one who should be ordering this test for you. Your urologist is the person who is generally in control, or is responsible, that's the word I'm thinking of, for your kidney stone care, right? They're the person who is monitoring your stones with likely annual scans, probably ultrasounds most regularly, sometimes CTs if they need to get a really, really clear picture. And they're the person who should be ordering this 24-hour urine test for you at least annually. The guidelines from the American Urological Association recommends that people who form kidney stones ever more than once, or people who are interested in prevention, which I have to imagine is every single person who's ever had a kidney stone is interested in prevention, should get this test at least annually. And this test is so critical because without it, we have literally no idea why you are forming stones, and therefore we have no idea what we can do to prevent stones. So despite this test being so crucial for preventative care, and despite this test being recommended in the official guidelines that all of our doctors should be following to prevent kidney stones or treat kidney stones, less than 10%, probably somewhere between 7 to 8% of people with kidney stones will ever get a 24-hour urine test, ever. And we should be getting them annually. Which is astonishing, and why that is beyond the scope of this podcast. I could probably talk for hours, but the reason that I wanted to put this podcast together is because so few of you are getting these 24-hour urine tests, and we need this test to come up with a stone prevention plan for you. It is a non-negotiable. Like, without this test, anything that we do to prevent stones, or any advice that they give, like follow a low oxalate diet or take potassium citrate or take this thiazide diuretic, all of those things are literally just guessing what's going to prevent stones for you. We need that 24-hour urine test to know what's going on in your urine to prevent stones. This is one of the many reasons why there's really no one kidney stone diet. And I talk a lot about this in episode 2 of the podcast titled, Why Is There No One Kidney Stone Diet? And one of the reasons for that is because even if you're forming the same type of stone, you could be forming a stone for very, very different reasons than your neighbor, right? There's millions of people who form calcium oxalate stones, but there are millions of different reasons and combinations of reasons why someone is forming that exact same calcium oxalate stone. And without knowing what that reason is, we really have no idea what we can do to prevent it. And so it's so important that you get this test. So how you get it is your doctor orders it for you. Typically, your urologist is the one that should be ordering this test for you for the vast majority of people who have stones, because most people with stones are only seeing a urologist for their stone prevention care. If you happen to also be seeing a nephrologist for kidney stones, that is also a good doctor to get this test for you. Typically, if you're seeing like I said, most people with stones only see a urologist. Sometimes you'll also see a nephrologist. Typically, those are the more complicated cases or severe cases of stones, because a nephrologist, if they are trained in stone prevention, are going to be the best person to help you put together that prevention plan, because urologists, unfortunately, don't tend to have much training in stone prevention. They're really, really good at getting kidney stones out of you, but typically, not all, but typically they don't have a lot of training in kidney stone prevention, and that's where a nephrologist is going to come in if your nephrologist is trained in stone prevention, and unfortunately, not all of them are trained in prevention either. But if you happen to be seeing a nephrologist, they should also be getting this 24-hour urine test for you. So I know that sometimes it can be really awkward, if you will, to go into your doctor and be like, hey doctor, this random person named Melanie online told me to get this urine test. Like, can you order it for me? I know that conversation can be a little bit intimidating and uncomfortable. And so I've put together a really wonderful document that's free. I'll put a link for you to get that document in the show notes, for you to just maybe learn a little bit more about this test, and also some of my tips for the exact language that you can use to ask your doctor for this test, and also what I would say to some of the common objections that I hear doctors saying to not give you the test, right? Like some of them are like, oh, it's not going to change how we treat your stones anyway. Well, I have some things that you could say to them. And some other common objections are, another one that I've heard a lot lately is that you shouldn't get the test if you currently have kidney stones in your kidneys. And that is absolutely false. You can absolutely get a 24-hour urine test if you have kidney stones. The only time that you can't get the test generally is if you're pregnant or breastfeeding, just because your urine chemistry is going to be so wacko, like it's not really useful. We kind of have to wait until that phase of life is over and things kind of go back to normal, and then we can work forward with prevention. And if you have current kidney stones, like that's no reason that you can't get a test. If you just had them removed, sure, maybe it makes sense to wait a few months and let things kind of settle down. But just because you have stones in your kidneys is no reason at all to not get a 24-hour urine test. I've seen hundreds of 24-hour urine tests of people who have stones in their kidneys. Because if we waited to get a urine test after those stones were gone, we could be waiting for the rest of your life, because people can walk around for decades with stones in their kidneys and be totally fine. And honestly, some don't even know that they have stones in their kidneys. So you absolutely can get it if you have stones. There is absolutely no reason that anyone, especially in the United States, shouldn't be getting a 24-hour urine test. Litholink is unfortunately only available in the United States as of right now, as of July 2024. But I know I've seen urine tests from Canada and France and Greece and like all over. So there's similar things, even if they're not quite as comprehensive as the Litholink, there are similar things in other countries. So the point is, ask your doctor for this 24-hour urine test. Definitely use my talking tips to ask your doctor for this test if you feel a little bit uncomfortable having this conversation. Another route that you could go is asking your primary care doctor. But honestly, like your urologist should be doing this anyway. And your primary care is able to order, but they might be a little bit more hesitant because they're not as familiar, right? And doctors have to follow up and treat you based on the results from tests that they order, right? Like it's not, a doctor is ethically bound to do something if they discover something by some test that they order. And so sometimes, understandably so, primary care doctors might be a little bit more wary to order these tests when they're just not familiar. This is outside of their not scope of practice, but kind of outside of their comfort zone, if they haven't worked with a lot of people who have kidney stones, for what to do with those results. And all of that honestly brings up another really, really good point, is if you are begging your doctor to get this 24-hour urine test, chances are they're not super familiar with it, because chances are they haven't ordered very many and just aren't very comfortable with interpreting those results. And like I said, unfortunately, stone prevention is not standard in urology training programs, at least in the United States. I have no idea what it's like in other countries, but certainly here it's not standard. And so I would caution you, like getting the test is great, right? It's definitely the first step, but then you really have to work with someone who really knows what they're talking about to interpret this test, right? Like it's great to have the results, but then what are you going to do with it? You have to work with someone who has the knowledge to put together that kidney stone prevention plan for you. So if you have a doctor who has ordered it and without you asking, and they seem very engaged in your prevention, you're probably in good hands. Ideally, you also work with a dietitian to help you with the nutrition side of things, because kidney stone prevention is certainly a medical and nutrition issue, right? A lot of times there's medications that are required, but nutrition should be part of all of these conversations. And unfortunately, it is not always the case. And that is why I do what I do. So I would say, honestly, like if you have to beg your doctor to get a 24-hour urine test, or they will not give it to you. I've rarely had this happen of all the thousands of people that I've talked to. But it has happened. And I would honestly say that if that's the situation that you're in, I would find another doctor. Like if your doctor has zero interest, despite you asking to actually help prevent stones, that's probably not a doctor that you want to be working with. I would, if my sister said that to me, I don't have a sister, but I have a brother, if my brother said that to me, or if my doctor said that to me, I would be looking for another doctor, honestly, because they just are not A, interested in helping you actually prevent stones, or B, aware of what the guidelines say and what we should be doing to prevent stones. So one other avenue that is available to you Because a lot of times people will say like, oh, like, Melanie, can you get a test for me? Or can my sister who's a nurse get a test for me? And unfortunately, it does have to be an order from a MD, from a doctor. Dietitians or nurses are not able to order it. But there is one company called True Health Labs who has a way basically of getting a whole bunch of different tests. And they just recently actually added a LithoLink 24-hour urine test to their repertoire of tests that you can order through them. And so through that company, you are able to get an official LithoLink 24-hour urine test, which is pretty sweet. The downside to this is you aren't able to go through insurance. Typically, 24-hour urine tests, if you have a history of kidney stones, are covered nearly 100% by insurance. So cost isn't really an issue. But if you do choose to go through True Health Labs, you can't go through insurance. So it is pricey. I believe it is around $600. But it is an option for you. If you really want to get this test yourself, you don't want to go through insurance, or you don't want to deal with your doctor, whatever it is, this is definitely an option for you. And I will post my affiliate link to the True Health Labs link to get that 24-hour urine test through LithoLink, if that's of interest to you. If you want our help here at the Kidney Dietitian to get those 24-hour urine tests interpreted, we definitely have some options for you because, of course, doctors are really good at the medical side of things and the prevention piece of things, but doctors are not dietitians and they're not nutrition experts, and dietitians exist for a reason, and a dietitian is really going to be the best person to help you understand those 24-hour urine test results from a nutrition standpoint, and most importantly, know how to actually make those changes in your life, like that's congruent with your lifestyle and your dietary patterns and habits and likes and preferences. A dietitian is definitely going to be the best person to actually help you interpret those results. We have two main ways that we help people understand all of this, understand your urine test results, and understand a personalized stone prevention nutrition plan for you. And that is working through our self-paced online course, Kidney Stone Nutrition School, or working with one of our dietitians. So the self-paced online course is, of course, by me. I walk you through your test results and tell you exactly what and how you can change your diet to prevent stones based on your 24-hour urine test. If you choose to enroll as a VIP, you also get to work directly with me via small group calls, as well as the opportunity to submit your urine test directly to me for written recommendations for you based on that test. So that is that Kidney Stone Nutrition School option, or you can work one-to-one with one of our Kidney Stone dietitians. All of the dietitians at the Kidney Dietitian have been well vetted by me. They have all completed my kidney stone training course. And so they have an approach to kidney stone prevention that is just exactly in line with my philosophy. So if you head to thekidneydietitian.org/clients, you can learn a little bit more about how those packages work. These are kind of the, this is the cream of the crop, right? This is the ultimate kidney stone prevention experience. You get one-to-one sessions with your kidney stone dietitian. You get access to everything that Kidney Stone Nutrition School has to offer. You also get very comprehensive analysis of your diet and one-to-one coaching and chat support and all of these types of things. So if that is of any interest to you, definitely head to thekidneydietitian.org/clients, and you can book a free call with any of our dietitians to learn a little bit more and explore working together. So that is all I have to say for this episode. I really hope it was helpful. I think, a lot of people don't have this test, obviously, and often will ask me, like, what do I do? How do I get it? So I wanted to, as succinctly as possible, kind of outline exactly how to get the test. The answer is really quite simple. Your doctor should be ordering it for you. If they're not, please use my tips to ask your doctor for this test. I will put a link to get that document in the show notes to this podcast. But if you really, really have to push, if your doctor doesn't pretty immediately say, oh, sure, like, I'll get that test for you, no problem at all, I would honestly probably be on the lookout for another doctor, because that doctor is not very interested in stone prevention. So, and I believe here at the Kidney Dietitian, as you know, my mission and vision of the Kidney Dietitian is that every single person with kidney stones gets targeted, individualized, preventative stone care, which I believe every person deserves. So with that, I will close this episode of the Eat Away Kidney Stones podcast. I hope you have a lovely day, and I will see you next time. Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.